Good afternoon, everybody. I'd like to welcome you all here today. This is a presentation by the Bar of Ireland of its Human Rights Award, and the very worthy recipient this year, who has kindly agreed to accept this award, is Dr. Mike Ryan. Human rights, we all think immediately of rights such as liberty, the rights to congregate, the rights to education, the rights to earn a livelihood. But the year 2020 can be marked as a year when health became the most oft used word, and a word that is associated with rights. It is a fundamental right, a right to health, because without health, you don't have your wealth, that old saying. There is nothing you can do without your health. So health is most prominent. It is also not just an individual right, but it is a collective right, in that the health of one, the health of one's family, and the health of society ultimately allows us all to function. Health in turn should not be determined by socioeconomic circumstances. It shouldn't be determined by the color of your skin. It shouldn't be determined by your creed. It shouldn't be determined by your beliefs. It shouldn't be determined by your sexual orientation. It should be and is and requires to be recognized as a fundamental right. It is a precious right, and one that none of us should take for granted, and one that we should all promote. And it is with that idea of the promotion of health as a fundamental right in mind that this year's recipient is Dr. Mike Ryan, who has been amazing in the work he has done in the protection of that right, not just for individuals, but for society as a whole throughout our planet. No individual or society can function without health. And in turn, that fundamental right to health brings us to the question also of the health system. We're not just talking about medical care, but we're talking about the other aspects of life that lead to healthy living. Access to healthy water, access to education, access to healthy food, access to equal rights, so that each and every one of us can avail of, hopefully, the vaccines when they become available, that each and every person has the right to avail of that, to ensure their own health and the health of their society. And finally, before I hand over to my colleagues, I just want to say that the award does not just recognize work in respect of physical health, but it's also mental health. One without the other does not work. We also are required, and it is incumbent upon us, not just as lawyers, but as members of this society, to ensure that we promote the human rights approach to health and health as an issue. So thank you very much.
Good afternoon, ladies and gentlemen, and as Chair of the Human Rights Committee of the Bar Council of Ireland, I am delighted and honoured to welcome you to our Human Rights Award ceremony for 2020. In particular, I'd like to wish a word of warm welcome to our very deserving recipient of this year's award, Dr. Mike Ryan. This year, the Human Rights Committee of the Council decided, in light of the issues thrown up by the COVID-19 pandemic, to focus on health as a fundamental human right. The pandemic has brought some significant matters in our lives into a sharp and real focus. Nowhere is this more apparent than in the area of public health. It's hard to believe that a virus that occurred in one part of the world could so quickly have had such far-reaching and devastating consequences in every other part of the world. In this way, the pandemic has been a forceful reminder to us of our common humanity. The preamble to the Constitution of the World Health Organization states, and I quote, "The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being." Of course, such a right is not enjoyed simply because it is written in a document, no matter how revered or lofty that document might be. It requires action and real commitment to work towards a situation where such a right has a real and meaningful impact on people's lives. This is where Dr. Micheal Ryan comes in. A review of Dr. Ryan's career shows that he has always been a man of action who has worked tirelessly in difficult circumstances to promote public health around the world and to promote the concept of public health as a right. Originally from the Sligo-Mayo border, Dr. Ryan qualified as a doctor in NUI Galway and thereafter followed a career which resembled something of a medical Indiana Jones. Following a great tradition of Irish doctors going to work abroad, in 1990, relatively soon after he qualified, he went to Baghdad to work with Iraqi doctors. With some auspicious timing, he arrived there just 3 days before the start of the Gulf War. When this occurred, Dr. Ryan became trapped in Iraq and had to work in Baghdad as a doctor in very difficult circumstances. Following his time in Iraq, he pursued a career in public health and has spent most of his career working in the World Health Organization. For a lot of his time there, he has had the responsibility of coordinating responses to outbreaks of diseases around the world. Far from being confined to what I suspect are the relatively pleasant surroundings of the WHO's headquarters in Geneva, he has spent an awful lot of time on the ground in countries where these disease outbreaks are occurring. In his own words, he is a field person. Earlier on this year, Dr. Ryan became Executive Director of the WHO's Health Emergencies Programme and has therefore had the onerous responsibility of coordinating that agency's response to the largest global health crisis in modern times. Even now, when Irish people generally seem to have a higher world profile, I think that we always tend to sit up and take real notice when we hear a representative of a worldwide organisation speaking with an Irish accent. So it was when in March of this year it seemed that, at frequent intervals, we were hearing what was undoubtedly an Irish person speaking on behalf of an international organisation to the world about the growing threat of COVID-19. And the world was listening. Clarity, honesty, and pragmatism were the values that came through as Dr. Ryan briefed the global community on behalf of the WHO. These briefings greatly assisted in the general understanding amongst the public at large of the nature of the virus and of the steps which had to be taken to contain it. One of the features of the pandemic has been that it has been necessary for governments to impose significant and unprecedented restrictions on the day-to-day freedoms of person so as to control the spread of the virus. Whilst there are inevitably different views as to the extent to which such restrictions are required, I think that it is fair to say that amongst the general public there has been a growing understanding of the connection between our activities in our day-to-day lives and the health of the wider community. There is also, I think, a growing understanding that the promotion of good public health as a global issue and a human rights issue in which we each have a role to play. Whilst this growing understanding has been a factor in the global response to the pandemic, it will hopefully also be a factor in forming the decisions to be made in respect of the administration of any vaccine which may become available. Dr. Ryan has, throughout his life, worked tirelessly and selflessly to bring about effective responses to public health crises, and through this, and through his advocacy, has promoted this understanding of public health as both a global and an individual issue. His vision, commitment, leadership, and example have promoted the concept of health as a right, which carries with it corresponding obligations on all of us to contribute to good public health. In this way, he has made a valuable and lasting contribution to human rights, and so the Bar of Ireland is honoured and delighted to recognise this contribution in awarding our Human Rights Award for 2020 to Dr. Micheal Ryan.
Inequality, injustice, marginalisation, racism, climate stress, internal displacement, migration, they all existed before COVID. COVID didn't invent these things. What COVID has done is really amplified and revealed and unveiled some of these deep-seated inequities in our society. If you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. The greatest error is not to move. The greatest error is to be paralysed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
Thank you all. Goramagat, Mara, August Joseph, Yiv Macorja, and allow me to start by expressing my deep gratitude for receiving this year's Bar of Ireland Human Rights Award. I'm honoured and frankly at the same time humbled by this acknowledgement, and I do struggle to accept any amount of credit for work and achievements attributed to me. I've always had the privilege and the pleasure to work with and learn from exceptional colleagues, friends, and teams who were united in their dedication to serve vulnerable and at-risk communities all over the world. And what I have learned most from, and whom I have learned most from, is from those very communities themselves. They have guided me and allowed me to learn more about how to do my job better. Over the years, I've been surrounded by a highly diverse group of people with an unbelievable level of commitment, enthusiasm, expertise, wisdom, experience, professionalism, leadership, and genuine good hearts. This has allowed me to learn, to grow, and to add my small piece to the puzzle. I'm grateful for this award. As I think, Maura, you outlined, it reminds us of how intrinsically linked health and human rights are. The World Health Organization, our constitution states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. Almost 70 years later, these words are more powerful and relevant than ever before. The right to health is central to WHO's identity and mandate. The right to health for all people means that everyone should have access to health services they need, when and where they need them, without suffering financial hardship. No one should get sick and die because they are poor, or because they cannot access the health services they need. Good health is also clearly determined by other basic human rights, including access to safe drinking water and sanitation, access to nutritious food, adequate housing, education, and safe working conditions. The right to health also means that everyone should be entitled to control their own health and body, including having access to sexual and reproductive information and services, free from violence and discrimination. Everyone has the right to privacy and to be treated with dignity and respect. When people are marginalized or face stigma or discrimination, their physical and mental health suffers. Discrimination in healthcare is unacceptable and is a major, major barrier to development. We must all work together to combat inequalities and discriminatory practices so that everyone can enjoy the benefits of good health, no matter their age, sex, race, religion, health status, disability, sexual orientation, gender identity, or migration status. However, as we've seen, and again, I think both of you, Joseph and Maura, referred to this, health emergencies, epidemics, and global pandemics are revealing right now some of the uncomfortable and inconvenient truths when it comes to access to healthcare. COVID-19 has laid bare some fundamental inequities in access to healthcare and how access or lack of access to healthcare can be used to empower or to curtail the human, civil, and political rights of persons as enshrined in the Universal Declaration of Human Rights. Access to healthcare in COVID-19 has not been fair. It has been influenced by gender, by wealth, by age, by social class, by legal status, by ethnicity, and by so many other factors. Chronically underfunded public health systems have faced a huge stress test to detect, investigate, and isolate cases, to track, trace, and quarantine contacts, and to provide a comprehensive response. We have witnessed the results of that underinvestment over the last 11 months, with public health systems struggling to protect and shield the health system, and that health system having taken the full brunt of this epidemic. Therefore, effective suppression of transmission has in many cases had to rely on more extreme measures, as an emergency brake in the form of movement restrictions and so-called lockdowns have had to be used. These measures in turn have triggered socioeconomic repercussions of a magnitude we still struggle to fully fathom. These fundamental challenges highlighted the consequences of the lack of focused investments in emergency preparedness, essential public health functions, and health systems resilience. We see health as a center of cost in our society, not as a center of investment for the future, not as a center for the security for all our people, but as a center of revenue and loss. And I think this has been a big mistake. Lack of access to health services, now exacerbated by the epidemic, has left billions of people, including many in rich countries, without reliable and affordable access to health services. Furthermore, massive inequalities have led to deaths and loss of livelihoods being strongly driven by socioeconomic status and further compounded by gender and minority status. As a consequence, the most vulnerable populations have been even more exposed and have become even more vulnerable. At WHO, we are concerned about the rights of health workers at the front line, who often work in the face of COVID without adequate training, without adequate protective equipment, have had to work extremely long hours, and have exposed themselves and sometimes their families to the horrors of COVID-19. We're concerned about the rights of older people who have been disproportionately affected by this pandemic, especially those living in long-term care facilities. We're concerned about the rights of internally displaced people and refugees and migrants, the rights of people in prison and detention centres, the rights of people with disabilities and those with underlying. Equity and access to safe and effective COVID-19 diagnostics, vaccines and therapeutics is and will be at the centre for the focus for WHO and its partners. Global pandemic response has not only triggered reflection about the link between health and human rights, but has also generated discussion about the balance between individual rights and the rights of society. Where do we draw the line between individual rights or freedoms and the collective responsibilities that accompany these rights? Do we have a right not to maintain physical distance or not to wear a mask, or do we have a responsibility to protect the people around us? Do we have the right to host a large gathering or party when that event risks amplification and further transmission of the disease? A response at community level can only be successful when it can be built on a social contract, on a community's knowledge and understanding of the importance of acting collectively. Some countries have been able to leverage this collective spirit, and the level of trust between a people and public health authorities, science and government has been established. Governments are grappling with dilemmas around mandating and enforcing individual or societal behaviour versus relying on public health and risk management advice alone. The core questions for governments right now are how to provide guidance to people and protect lives without interfering too much in those lives. We have to find a way to meet the expectations of freedom while at the same time controlling a deadly disease. But a global emergency may never be used as an excuse to impinge on hard-won individual rights in a society. As we have seen, epidemics can be exploited as an opportunity for human rights violations. They can be used as an excuse to further isolate marginalized groups, to blame minorities, to stigmatize, to incite fear. We have seen this pattern during the HIV epidemic with TB and polio, and we are seeing it again with COVID-19. A contagion drives primary emotions in human beings and drives deep-seated fears that can be exploited to make people other and to create discrimination upon those individuals. A contagion, fear can be manipulated against a particular type of person, a particular ethnic group, or a particular section of society. In several contexts, local and international human rights groups have described fears about how COVID-19 related emergency measures have been accompanied with different kinds of specific threats against their ability to work safely and independently and raise human rights concerns. The space to advocate for accountability, transparency, and the respect for human rights cannot be squeezed in this way. We must have dialogue and we must have accountability. We need to establish a reasonable balance between the rights of the individual and the rights of society without impinging and squeezing upon the rights of people to protest and to ask questions and to call for the accountability for those of us who are paid in their service. We've witnessed that a central challenge during the response to the global pandemic has been leadership, coordination, and governance. Governments have proven to be most effective when they were able to connect with their populations, create a dialogue around a shared sense of suffering, a shared sense of tragedy, and a shared sense of responsibility. This has allowed space for unity and counters misinformation and fear. How a response should be implemented and enforced is a careful matter of balancing and being proportionate in protecting the rights of individuals and communities. How do we make sure that our legislative bodies and our legislation is supporting both the right of the individual and the right of communities to feel protected and safe? Too many people have exploited the cause of the rule of law. The law is owned by the people. It is implemented by those of us and others who act in the interest of our people. It is not the instrument of politics. It is that which protects our very society. The rule of law should not be owned by a given ideology or a certain section of society. This balance has been a real challenge for many countries. How do we ensure that laws do not become political footballs, instrumentalized by populism? How do we ensure that we, the people, understand that we own the legal system and that we associate its rules of behavior are there to protect us, to protect our families, to protect our communities? We own the law. For us at WHO, the international health regulations is our only international instrument that allows us to regulate and manage the international threat of infectious diseases. It is only one of only two legally binding instruments that exist in international law and has been agreed by 196 countries across the world and entered into force in 2007. That is an agreement between those member states. We are just the secretariat that implements that. And I'm sure Maura and Joseph, as lawyers and as people in the legal profession, you don't get to make the law. You get to interpret the law, you get to apply the law, but you don't get to make the law. It's the same for us in WHO. We try our best every day to implement the IHR in the spirit in which it was intended. But like any legal instrument, it has its limitations because it has been created by our member states. So we must find the balance between the responsibility of member states to implement and live by the law they have created and the power of a secretariat to enforce and implement that very law. And this is a real issue at the moment in terms of how we find that balance going forward, in terms of the mandate of WHO as a professional secretariat and WHO as a collection of member states. The stated purpose of IHR is to prevent, protect against, control and provide a public health response to the international spread of diseases in a way that are commensurate with and restricted to public health risks and which avoid unnecessary interference with international travel and trade. It's a very short sentence, but there's a very big set of rules around how that is done. But that international instrument is often in contradiction with national laws and national interests. And at times, this has created a great debate around who controls the movement of people, goods, services during the time of pandemic. How does a society establish a fair balance between protecting health, protecting the economy? Is this a real or fair dichotomy? And this is an instrument the IHR has to live with that tension, the need to control disease and the need to protect the very thing that drives our economy, the open movement of people for trade and the open movement of goods for commerce. I would like to conclude here and hope that in the future we can work together between the health and legal professions. We do and cannot at the moment begin to even think about creating new bodies of law that are sufficiently adequate to deal with this pandemic. But I do think in future we will need to, at both national and global level, review our public health law and make sure it's fit for purpose for the threats we face now in a globalized world. We will need a much broader discussion about public health law and epidemics. And can we define well-adapted legal structures and legal processes that help contain epidemics without destroying some of the fundamental rights that people have fought so hard for through the last decades? I'd like to reiterate WHO's commitment to a human rights-based approach to health, as Joseph said, and combating COVID-19, and doing that in a way that prioritizes the needs of the most vulnerable. Our Director General, Dr. Tedros, has said many times that we are all in this together, and this is not over anywhere until it's over everywhere. One person matters. One life matters. The rights of any single individual matters and must be seen and protected in every way we possibly can. Thank you.
Thank you very much, Dr. Ryan. Not only was that an inspiring speech, but the work that you have been engaged with over the last 12 months, and indeed the work that the World Health Organization has been involved in over the last 12 months, has given us all cause to think and to thank you. I note your comments about the rule of law, and we at the Bar of Ireland firmly believe that laws are there to assist people, not to oppress people. When laws become oppressive, not just of individuals, it ultimately leads to suppression in society. But as you say, the law should be there to protect as well. And that includes the protection of all rights. But as I say, the reason you're here today is to receive the award for human rights premised upon health work. So it's the right of health, and 2020 underscores the need in respect of that fundamental right of health. And hopefully some good will come out of 2020 in respect of recognizing the need for health premised, as I said before, not on your socioeconomic standards, but that it's a right for everybody. And with hopefully the distribution of vaccines, hopefully in the coming year, it will be like a rising tide, that it'll bring everybody with it, that a rising tide lifts all boats. And 2021 hopefully will lift a dark cloud that seems to have hung over the world in 2020, resulting, as you say, in populist approaches to matters, not necessarily in the most logical fashion, and certainly in some instances, not in the most constitutional or democratic or lawful fashion. One of the concerns would be that in the Western world, there seemed to be a certain amount of lack of leadership and a lack of coordination. And thankfully, the World Health Organization was there to provide some of that leadership in respect of health and to try and fill that gap, fill that void. But there is still a void there in respect of how the world approaches this, how the world will deal with the need to ensure that health is underscored as a fundamental right, not based on your wealth, not based on whether you live in the Western world, not based on which country in the Western world you live, not based on the color of your skin, whether you've been educated, whether you're in prison or out of prison. It's a right for everyone. It's like fresh air. And ultimately, 2020 will hopefully lead to everyone in the world recognizing that health is as precious as fresh air. So I'm just going to finish off by saying thank you so much, Dr. Ryan. I did have one question for you, which Irish people will understand, but I know you're from the Mayo-Sligo border, and I was wondering, do you wear the red and green or do you wear the black and white? And this from a woman from Leitrim. We very rarely get to wear any championship colours for too long.
Thanks, Maura. First of all, thank you again to both of you for the words you've spoken, and particularly, Maura, to you for your message of hope there at the end. because I think I'm an incurable. My staff call me a pathological optimist, and sometimes unrealistically hopeful in situations. But I have a fantastic faith in human nature, a fantastic, and I've seen the most wonderful things and the most wonderful acts of kindness and courage all the way through my career in the most extreme of circumstances. I believe we are inherently good, we are inherently smart, we're inherently fair. And I do believe the next generation uh, want a better and safer, fairer world. They want a healthy environment. They want the climate to be a positive aspect of our lives, not an existential fear. They want health and education to be rights. And I think we have a duty to deliver something better. We have a duty. I think John F. Kennedy said that our youth, I think our youth are the messengers we send to the future that we will never see. And I think in that regard, we have a lot to do, both in health, in law, in human rights, to ensure that we create the conditions in which people can thrive in the future. I think you're right. The COVID epidemic has highlighted not only some of the inequities, but some of the opportunities. It's shown that science, solidarity, human rights, and solutions that we're better than what we think of the worst of us. That we actually are able to do. We've done some amazing things. The Irish people and others have crushed the curve twice in the last 10 months for a disease we didn't even know existed 11 months ago. We've had the fastest cycle of the development of diagnostics and drugs and vaccines in the history of this planet. We have done some amazing things, but the challenges are still there. The inequities have been exposed. The question is, what do we do about it? Regarding the Mayo Sligo issue, I would nearly prefer to be dealing with the climate crisis than trying to declare which of those two counties I come from. Um, my father was born in Tubbercurry, my mother in Charlestown, and everything in between. But my friends from Curry and Sligo tell me I played my football for the parish of Curry, so therefore that's what my passport is stamped with. But I have great loyalties. I may have to declare for Leitrim more though, because this is a serious diplomatic issue at the moment. So I'm looking for another county to take me in if the fighting becomes too bad at the Mayo Sligo border. But I am proud to be from both, and I'm proud of my heritage. I'm an Irish national. I'm a global citizen, but I'm very proud of my heritage and very proud of the place that I come from. And I do think, and again, the Irish abroad, the diaspora, those who may be listening to this out there, the Irish do well abroad because of the values and the mores and the attitudes we take with us from our home country, and the willingness to engage and talk and conversation, our openness to the views of others, our natural tolerance, the qualities of sharing, the qualities of whatever little you have, you share. We all, and I think I'm so proud to work with so many other humanitarians, Irish ones abroad, particularly peacekeepers and others. We should be so proud of the people who've spent the last 50 years giving of themselves and sometimes losing their lives in the cause of peace abroad. And there are many people in Ireland who should take a bow, way more than me. And there are many more families that have sacrificed way more than mine in terms of the fight for peace and human rights on a global basis. But again, proud to be a Sligo man, Mayo man. But obviously, the safest thing I can say is that I played my football for Curry. So that's where I'm from.
Oh, well, thank you very much, Dr. Ryan. And that's bringing everything to a conclusion. And I just wish you well. And I hope that everyone does stay safe and well. And keep up the good work, Dr. Ryan. Thank you, everybody.
Thank you all.